Understanding clinical trials. What follows is a consent form for a trial that is not being carried out right now, but for which you might be eligible if it were. Each page will include narration. Following the narration, please take all the time you would like to review the text, and then proceed to the next page when you're ready. The title of the research study is RN 2000 for treatment of hypertension. The principal investigator is Dr. Christopher, and the sponsor is Zancorp. Why am I being invited to take part in a research study? You're being asked to participate because you have been diagnosed with hypertension or high blood pressure. What should I know about this research study? Your participation is entirely voluntary. You don't have to be in this research study. If you join the study, you can stop or leave at any time with no changes in the quality of the health care you receive. You'll be told about any new information or changes in the study that could affect your willingness to continue participation. You can ask all the questions you want before deciding if you want to be in this study. Why are we doing this research study? Over 40% of patients receiving treatment for high blood pressure aren't able to achieve even modest levels of blood pressure control, and patients often require more than one medication to effectively lower their blood pressure. The purpose of this study is to test a new medication called RN 2000. We want to find out what effects, good or bad, it has on people with high blood pressure and compare these effects to a similar medication called exenterin. Both RN 2000 and exenterin are in a class of drugs called direct renin inhibitors, a newer type of medicine used to treat high blood pressure. Both RN 2000 and exenterin work similarly, but RN 2000 has been altered somewhat so that it may have fewer and less serious side effects than exenterin. Neither RN 2000 nor exenterin are meant to replace any current treatment, and they both can be taken in combination with other medications to control high blood pressure. Zancorp is the company that created and makes the experimental medication RN 2000 and other medications. RN 2000 hasn't been approved for this use by the U.S. Food and Drug Administration, FDA. RN 2000 has been tested in animals, in healthy people, and in single doses with patients with hypertension. Exenterin is approved by the FDA for hypertension and is sometimes used in addition to standard medications for hypertension. How long will the research last? We expect that you'll be in this study for 28 weeks, requiring 11 outpatient visits. How many people will be studied? We expect about 50 people will be in this study at this site out of 500 people in the entire study nationally. Will I definitely receive the experimental medication? No. The decision to give you RN 2000, the experimental medication, or exenterin will be made by chance, like flipping a coin. You'll have a 50-50 chance of being given RN 2000 or exenterin. Neither you nor the study doctor will know which study medication you're getting. In an emergency, a doctor can find out what you're taking by calling the on-call investigational pharmacist. What happens if I say, yes, I want to be in this research? You'll have the following test to see if you meet the requirements for being in the research study. Prior to beginning the study, you'll have a health history review. We'll ask about your general medical health, your use of drugs, alcohol, and tobacco, and your medication use history. Demographic history. We'll ask about the ethnic background of you and your parents. Vital signs. We'll check your weight, height, blood pressure, and pulse. You'll have blood samples drawn and be asked to provide a urine sample. Pregnancy test. If you're a woman and can have children, your blood sample will be tested to see if you're pregnant. If you're pregnant, you can't take part in this study. You'll have to be using a highly effective form of birth control to be in the study. If you meet study criteria, you'll be randomized into one of the study groups. What happens during the study? You'll be asked to come for a study appointment weekly for 4 weeks, then once every 4 weeks for 5 additional visits, then at week 28 for a follow-up assessment. At each visit, we'll check your vital signs, including your blood pressure, draw a blood sample, ask for a urine sample, complete a brief health questionnaire, assess any side effects you may have experienced. Study staff will be available between your study visits to address any questions or concerns you may have. What happens after the study? After the entire study is finished, or all the people taking part have finished the study and all the effects of RN 2000, both good and bad, have been compared to Excentrin, we could tell you which study medication you took if you desire to know. Below is a schedule of study appointments and procedures. In the left-hand column, you'll see a list of all the procedures that you'll be asked to do during the trial. The top row lists all of the times you'll come in for a study visit. A check mark tells you what procedures will happen at each visit. Please take all the time you would like to review it and then advance when you're ready. What are the risks of being in this study? Risks of the experimental medication include the following side effects of RN 2000, which have been most commonly reported: diarrhea, dizziness, headache, fatigue, or rash. Other side effects that have not yet been reported could occur. Risks of the approved medications include the following side effects of Excentrin, which have been most commonly reported: diarrhea and other gastrointestinal disorders, dizziness, headache, fatigue, common cold symptoms, kidney stones, gout, and rash. Severe allergic reaction is one of the serious side effects of both medications. Get medical help right away if you have any signs or symptoms of a severe allergic reaction, including trouble breathing, swelling of your face, lips, tongue, or throat, hives. Excentrin may cause a serious allergic reaction called angioedema. Angioedema is swelling that happens just below the surface of the skin, most often around the lips and eyes. Contact your doctor at once if you develop swelling of the hands, face, lips, eyes, throat, or tongue, difficulty swallowing or breathing, or hoarseness. Other potential risks of participating in the study include risks associated with drawing your blood, such as for a pregnancy test when applicable, like redness, swelling, pain or discomfort, and bruising at the site of the needle stick. Some people may experience dizziness, lightheadedness, and/or fainting. What are my responsibilities if I take part in this research? If you take part in the research, it's important for your safety that you follow the directions of the study doctor and research staff, tell your study doctor and staff about all medications you are taking now, prescription and over-the-counter, and any new medications that are prescribed to you. If you become pregnant or think you may be pregnant, inform study staff right away. When used during pregnancy, renin inhibitors can cause injury and even death to the developing fetus. Don't use illegal drugs or incorrectly use prescription medications. Will being in this study help me in any way? You may not benefit directly from being in this research study if you're assigned to take the experimental medication and it doesn't prove to be effective. It's hoped that the RN 2000 may help lower blood pressure with fewer side effects than Excentrin, but we can't promise that this will happen. However, the results of the study may help others in the future. Will being in this study cost me any money? There will be no additional cost to you from being in this research study. The medicines, clinic visits, and tests that are done for research purposes will be free. Any cost for the standard treatment of your condition will be billed to you or your health insurance. What happens to information about me? We'll try to limit access to your personal information, including research study and medical records, to people who have a need to review this information. We can't promise complete privacy. The University of Massachusetts Medical School Institutional Review Board, the committee that reviews, approves, and monitors research on human subjects, and other representatives of UMass may need to review your records. As a result, they may see your name, but they are required not to reveal your identity to others. The study sponsor, Xancorp, and/or their representatives, and the U.S. FDA may inspect your medical records that pertain to this research study. Your identity will remain confidential in any study results that are made public. What happens if I'm injured because I took part in this research? If you're injured while in the study, seek treatment and contact the study doctor as soon as you're able. If you're injured or have any harmful effects as a direct result of the administration of RN-2000, Excentrin, or any procedure required by the research, necessary medical treatment will be made available to you at UMass Memorial Medical Center. The sponsor, Zancorp, will pay the reasonable and necessary medical costs for study-related injury that isn't eligible for billing to your medical insurance. To pay these medical expenses for a research injury, the sponsor will need certain information about you, such as your name, date of birth, and Social Security number. This is because the sponsor has to check to see if you receive Medicare. If you do, the sponsor must report the payment it makes to Medicare. The sponsor can't use your information for any other purpose. The sponsor has no plans to pay for medical expenses for injuries that aren't directly related to your research participation or that are caused by the natural course of your disease. The sponsor has no funds set aside for any other form of compensation in the event of a research injury. You don't give up any of your legal rights by agreeing to enroll in this study. Will I be given any money or other compensation for being in this study? You'll be reimbursed for your time, travel, and other expenses associated with this research study. You'll be paid $50 at each clinic visit. If you complete all study procedures, you'll be reimbursed a total of $550. In order for us to pay you, you may need to give us private information like your home address or Social Security number. In addition, free parking for all scheduled visits will be provided to you during the study. Zancorp will be the owner of the study data. Zancorp plans to use the results and may get patents or sell the medication in the future or make profits in other ways. You won't be paid for any part of this. What happens if I say yes, but I change my mind later? You're free to leave the study at any time. There are no penalties, and you don't lose any benefits to which you're otherwise already entitled. If you decide to permanently discontinue treatment prior to the end of the study, you will be asked to come in for a final appointment to return any unused medication and answer some questions about your experiences and how you have been feeling. If you leave the study and don't agree to provide more information, then no more information about you will be collected. Data that we have already will stay in the study database and cannot be removed to maintain the integrity of the research. However, you can ask us to destroy any information that identifies you so that no one knows that the data came from you. Our contact information is below. Can I be removed from the research without my permission? The person in charge of the research study or the sponsor can take you out of the study even if you don't want to leave. This may happen if the investigator decides that continuing in the study would be harmful to you, you need treatment not allowed in this study, you fail to keep your appointments or take the medications as instructed, you become pregnant, or the study is canceled by the company making the medication, Zancorp, the FDA, or the UMass Institutional Review Board. Who can I talk to? If you have questions, concerns, or complaints, or think the research has hurt you, you can talk to the research team at this number, or contact someone from the UMass Institutional Review Board at the phone number or email listed here. Thank you for taking the time to review this presentation. Please click here to complete a brief survey.